Thank you everyone for joining us today. It is June 23rd, 2021, and this is a combined meeting of the Board of Commissioners and the County Council. And I would like to acknowledge, first of all, that we welcome you to this meeting on the report of the Criminal Justice Reform Study in Monroe County. And I will note that in addition to myself, Lee Jones and Penny Giffens are here from the Board of Commissioners. Mr. Spoonmore, the President of the Council, would you like to introduce your colleagues?
Yes, thanks, Commissioner Thomas. So in addition to me, we have Councilmember Deckard, we have Councilmember Kate Wiltz, we have Councilmember Jeff McKim, Councilmember Peter Iverson, who are present with us here currently.
Excellent, thank you. And I will note for the record that as of right now, we have a number of our stakeholders who are present as well from the county. Judge Mary Ellen Dekoff, Jail Commander Sam Crow, Community Corrections Director Becca Strite, Prosecutor Erica Oliphant, and Public Defender's Office Michael Hunt. And there probably will be others joining us soon as well. Just a brief introduction about this report, and when we say report, there is a written report available from our homepage, co.monroe.in.us. And when you logged into this Zoom meeting, you also saw a link to that report. In 2019, Monroe County engaged with a group of expert consultants in order to help us review every part of our county's criminal justice system. The county commissioners, county council, prosecuting attorney, the sheriff, the board of judges. We all made a commitment to review and reform Monroe County's criminal justice system. The justice system includes any public employee from a public agency that engages with a person, and that could be anything from an interaction or an arrest by law enforcement, and if convicted, through the end of probation, and everything that happens in between. The consultants gathered data on corrections and the criminal justice system, our local social service agencies, and incorporated input from 4 community conversations that were held in the summer of 2019. Community justice and mediation provided the framework for some of those very interesting conversations that we had. And of course, COVID provided us with a bit of a delay in getting this report completed. Those conversations with community members also informed our study.
So we're pleased now to introduce 2 of our consultants. Eve Hill is an attorney who serves as a principal of Inclusivity Consulting. She is one of the country's leading disability rights attorneys and an advocate for civil rights. She hails from Washington, D.C. Kenneth Ray, Doctor of Behavioral Health, is the principal consultant of his firm RJS Justice Services in Louisville, Kentucky. With 4 decades of experience in corrections as well as criminal and social justice work, his focus is on data analysis for this project. Dr. Ray worked with Dr. Beck at Justice Concepts on this report, and Dr. Beck, the principal consultant with Justice Concepts in Kansas City, Missouri, has more than 40 years of experience. His work includes identifying alternatives to incarceration.
Right, and so tonight we have the opportunity to hear from Ms. Hill and Dr. Ray. They're going to explain what was learned in the study of Monroe County's criminal justice system, as well as the county's strengths and gap analysis. So this is a community meeting, so the public will have an opportunity to ask our consultants questions and to offer comments. We are all here to listen and learn. And with that, we'll turn it over to Ms. Hill, please.
Good afternoon or good evening. I wanted to say, first of all, thank you to all the many officials of the county and other governments in the area and all the community stakeholders who gave us their valuable time to consult with us. It was invaluable, and we gathered a lot of information. And as we know, any estimate of whether a new jail is needed or whether changes to the current jail is needed, and if so, how big any new jail has to be, depends on whether Monroe County can change the circumstances that have led to overcrowding at the current jail. So staff at the current jail estimate that a huge number of jail inmates have some form of mental illness. In addition, arrests of people for substance use disorder related crimes such as DWI and possession account for a hugely significant number of jail days annually. And all of those arrests and detentions contribute to overcrowding, taxing of available resources, and burdens on jail staff and liability issues, as well as the collateral consequences for individuals, families, and Monroe County communities. So our task was to look at what is leading people with mental illness and substance use disorders into jail in the first place and back into jail after initial incarcerations, and to explore opportunities for interventions other than arrest and detention for people with mental illness and substance use disorders. So we're looking at avoidance, detention, and avoiding recidivism. Importantly, our recommendations apply whether or not a new jail is built. These improvements will help Monroe County avoid simply refilling any new facility. They will also help Monroe County use its funds wisely to maximize state and federal contributions and get the most bang for the buck. And my report applies the SAMHSA, the Substance Abuse and Mental Health Services Administration's sequential intercept model, to the available information about Monroe County's criminal justice system and its mental health and substance use disorder systems, to identify how people can be diverted from, avoid, or be kept from returning to the criminal justice system. The sequential intercept model focuses on intercept points within the crisis and criminal justice systems that can prevent, divert, and prevent reentry to criminal justice involvement at the point of criminal justice involvement. I expanded that analysis to address the broader mental health and substance use disorder treatment systems in place now and how those systems could be supported to prevent criminal justice involvement in the first place. The intercept points that we looked at are what we call Intercept 0, which is community services and crisis services. Those are opportunities to divert people into local treatment services, whether through 911 or through other connections without arrest or charge, such as mobile crisis, co-response models, emergency room diversion, and police behavioral health collaborations. Intercept 1 is law enforcement. Diversion by law enforcement or other emergency service providers to treatment services without arrest or charge, including dispatcher training, specialized police response, affirmative interventions with frequent utilizers, and post-crisis follow-up. Intercept 2 is initial detention and initial court hearings, which allow diversion to community-based treatment by jail clinicians, social workers, or court officials during jail intake, booking, or initial hearings, including things like screening for mental illness and substance use disorders, data matching between jail and community-based treatment providers, and pretrial diversion and supervision. Intercept 3 is jails and courts, allowing for diversion to community-based services through jail or court processes and programs after booking, including problem-solving courts such as you have here, and services that prevent the worsening of a person's illness during a jail stay, such as jail-based programming and health services. Intercept 4 is reentry, which is supported reentry into the community after jail to link people in jail to treatment services and ensure that warm handoffs take place before release, to reduce further justice involvement after release, such as transition planning by reentry coordinators, peer support staff, and community inreach by providers, medication and prescription access before and upon release, and warm handoffs from corrections to providers. And Intercept 5 is community corrections, meaning specialized community-based criminal justice supervision with added supports for people with mental illness and substance use disorders to prevent further violations or offenses. And we also looked particularly to the evidence-based practices in the field that show the key services that are needed in a community to prevent avoidable criminal justice involvement of people with mental illness and substance use disorders. These include assertive community treatment, supported housing, mobile crisis services, supported employment, peer support services, cognitive behavioral therapy, contingency management and motivational programs, and medication-assisted treatment. Some of our key overarching findings is that Monroe County has a high uninsured population. While Medicaid is intended to avoid poor people from being uninsured, and Medicaid in Indiana covers most of what's needed in Monroe County, Medicaid barriers to enrolling in, paying for, and keeping Medicaid lead those to barriers in getting and sustaining treatment for mental illness and substance use disorders. And that leads to crisis and criminal justice involvement. Another key finding is that lack of affordable housing leads to homelessness in Monroe County, particularly for those with mental illness and substance use disorders. And permanent supportive housing is a good answer for this, and Monroe County has already seen success from its current permanent supportive housing programs, which need to be increased in capacity. Finally, an overarching concern is that avoidance of criminal justice involvement could be improved through improvements in coordination, information sharing, and cross-pollination among the various stakeholders inside and outside of the criminal justice system, including Monroe County government, Bloomington government, the IU, and community service providers. Now, Monroe County has a number of strengths at each intercept point, including a strong leadership base committed to criminal justice reform that has already put in place some key elements designed to prevent avoidable incarceration, such as mental health and drug courts, jail programs to treat and re-enter people with mental health and substance use disorders, and the new Stride Center. Monroe County also has a network of service providers, nonprofits, employers, and others who are committed and deeply committed and collaborative in their efforts to respond to mental health and substance use disorders. And most of the essential services needed to prevent avoidable incarceration exist in some amount in Monroe County. So Monroe County knows what to do and how to support those services. They don't have to reinvent anything here. Law enforcement agencies have shown a willingness to use diversion resources when they're available. And mental health screening and dedicated mental health staff and mental health and reentry programs at the jail are in existence. We also have 4 functioning problem-solving courts. The prosecutor's mental health review team diversion program is also another strength. And we have a strength of community providers who specialize in services for those re-entering the community after incarceration. So there's a lot of strength here. We just need to act on it and improve it. But Monroe County needs to right-size these strengths in order to maximize the prevention of avoidable incarceration. And some of the ways we need to do this are through leadership, coordination, and information sharing across the criminal justice, mental health, and substance use disorder systems with a shared goal of reducing or avoiding the need for incarceration. There are a lot of groups meeting right now and with different goals. One shared goal needs to be the reduction of incarceration and how specifically we get those systems to work together to achieve that goal. And those need to include leadership from Bloomington and IU, as well as from the community. We need increased availability of medication-assisted treatment and residential treatment for substance use disorders. We need assertive community treatment and forensic assertive community treatment to specialize on people returning from incarceration. We need increased peer support services. Peer supports are a key element in helping people with these disorders re-engage with their communities. Sorry, the chat keeps popping up. And avoid recidivism. And we need scattered site permanent supportive housing for a number of reasons I'll talk about later. We also need job placement and supported employment. For many, jobs are treatment for people with mental illness and substance use disorders. And right now we have some job placement and supported employment services, but not enough to serve the need. We also need individual, street, and remote psychiatry. A lack of enough psychiatrists in Monroe County has long been pointed to as a problem preventing the effective treatment of people with mental illness and substance use disorder pre-crisis and at crisis. We need supports to overcome the Indiana Medicaid barriers to treatment. Those barriers include lockout periods. When people don't pay their contributions, they can be locked out for 6 months, and then they have no insurance, which prevents them from getting treatment for mental health and substance use disorders, which leads to crisis, which leads to incarceration. We have monthly contribution requirements. Bear in mind that Medicaid is a program for people with low incomes. And so contribution requirements, even if they seem small to people with higher incomes, can be a complete barrier to getting insurance for the people with low incomes. And we have Medicaid enrollment barriers. The enrollment process is difficult and delays in getting approval. We need supported employment programs and incentives for employers to participate. Over and over again, it's been pointed out that employers have hesitancy to participate in supported employment programs or to hire people with mental illness and substance use disorders. And we need transportation resources for medical appointments. One of the big frustrations for the psychiatrists who do this work is that people don't make it to their appointments. And that is largely a factor of the lack of sufficient public transportation to the places where they need to get for those appointments. We need more non-law enforcement options for responding to mental health and substance use disorder crises, such as crisis hotlines, mobile crisis services, detox services, and peer supports. And another need is increased law enforcement use of those non-arrest interventions, even when arrest is a legitimate option, such as the Stride Center. So this is to divert people from arrest, even when arrest is a legitimate option. So far, most of our law enforcement are using the Stride Center and other non-arrest diversion techniques only when arrest isn't really a diversion, isn't really an option. We need increased mental health staffing and mental health and substance use disorder programming at the jail. This is a key element to creating reentry programs that work and that prevent recidivism. And we need reduced barriers to entry to the problem-solving courts, addressing costs, hours of operation, and graduation requirements that currently make it hard for people to participate in those courts. We came up with 42 recommendations. I know, I won't go through them all today. I'm going to focus only on 20. I couldn't narrow it down any further, I tried. So the 20 recommendations include increasing mental health staffing and K-block and other mental health and substance use disorder programming and case management at the jail. This helps people get back on track, get into reentry, get connected with community providers once they're in reentry, and avoid recidivism, which, as Dr. Ray will talk about, is a major contribution to the longer stays that the jail is currently facing. We also need to consider waiving copays for mental health and substance use disorder treatment. This is a desire that both the county and the person share. And the county should bear in mind that sharing in and participating in, supporting those treatments while in jail saves you money, saves you time, saves you impacts on your communities in the long run, because it saves recidivism. Another recommendation is to reduce the barriers to participating in and graduating from problem-solving courts, including reducing the amount and cost of drug testing to just those that's really needed and that's really going to predict success. Eliminating or restructuring the participation fees, which are a barrier to people deciding to participate in the mental health and drug courts, and exploring evening hours for mental health court and evening and weekend hours for regular supervision meetings and drug testing, because these courts require you to get a job or be trying to get a job. And during work time hours, meetings and court hearings interfere with the ability to achieve that key aspect that's needed for graduation. Now, while the courts do the best they can to reduce these barriers on case-by-case bases, consistency and transparency about eliminating these barriers across the board would likely substantially increase participation in the problem-solving courts. Another effort that's important is working with the state legislature and the state Medicaid and mental health agencies to secure authority to pursue American Rescue Plan funding. Under the new American Rescue Plan, the COVID relief plan, basically, the federal government will pay 85% of the cost of mobile crisis teams. So you need more mobile crisis teams, and the federal government through this program will pay for it. And Monroe County can work with the state government to make sure that the state takes advantage of that program. It doesn't have to be statewide if they are unwilling to pursue a statewide program, but it can be locality specific. So if Monroe County advocates for this to be in Monroe County, that's a possibility. And then another is to work with the state Medicaid and mental health agencies to take advantage of the new enhanced federal match rate for home and community-based mental health services under the American Rescue Plan, which would allow you to expand capacity for case management, mental health rehabilitation, waiver, and other services that could really help avoid incarceration and arrest, all paid for by the federal government and to a lesser extent the state. Another recommendation is to reduce the number and increase the efficiency of countywide collaboration efforts by appointing a criminal justice coordination leader to conduct a network analysis of the coordinating groups that exist, identify gaps and overlap and duplication, and identify more efficient methods of collaboration, develop infrastructures for the groups, and facilitate the groups to develop a consensus on shared structure, goals, activities, responsibilities, reporting, accountability, and troubleshooting mechanisms. And it's important that this have buy-in from other government stakeholders like the Bloomington Police Department and IU and IUPD. Another recommendation is to train Monroe County Sheriff and IUPD officers on the Stride Center and require its use in all appropriate cases, not just those where an arrest is not possible. And providing 40-hour CIT, community crisis intervention training to sheriff's officers and training 911 dispatchers in the alternatives to law enforcement interventions for mental health and substance use disorders, so that the cop is not the only answer, that other answers can be dispatched when they are more appropriate. Increasing community detox services. Right now, a large percentage of people are detoxed in the jail, which is not an ideal place to detox. It raises liability risks for the county, and it leads to the collateral consequences that many people feel from spending any time in jail. I would also recommend implementing an overdose rapid response team. An overdose rapid response team is a multidisciplinary team, including law enforcement and non-law enforcement, who intervene with an opioid or non-opioid overdose victim quickly when they're probably at their most likely to be willing to enter into treatment, and to encourage them and facilitate their entry into treatment through through less of a focus on arrest and incarceration and more of a focus on here's the way to avoid arrest and incarceration by seeking treatment and complying with treatment. We also recommend expanding emergency housing options for those who need low barrier shelter but cannot access them, largely because of religious reasons. And we recommend increasing the use of the Stride Center, which has also already shown great effects, but also it needs to have its long-term stability secured. It has funding now for 3 years, and one of those years is already over. And then increasing the use of the Stride Center, because the use of the Stride Center is less than its capacity right now, and there's certainly enough need for its use. We recommend expanding the existing assertive community treatment program to those with fewer hospitalizations, especially those who have hospitalizations and are either homeless or have been incarceration, because those are triggers that would lead to the ACT programs being useful, as well as implementing a forensic ACT team to deal specifically with the needs of re-entering citizens. We also recommend pursuing a frequent users program. So many of these recommendations that I've talked about could be expanded to everyone, or they could be focused really tightly on the frequent users of the criminal justice system, frequent users of emergency rooms, frequent users of crisis services. That helps to avoid crises. It helps to push the issue away further and further out from the criminal justice system. So a frequent user program, if the data were available and to be shared, and there are mechanisms for doing that, could really help target the interventions that you need without requiring you to offer them to everyone in the county. We recommend assisting qualified providers to become approved for Medicaid and/or DMHA-funded medication-assisted treatment and residential substance use disorder treatment for frequent users. This is another, not a gap because there is some of the service, but it's not sufficient to meet the need. And working with the state to ensure the continuation and expansion of telepsychiatry reimbursement through Medicaid. The state has allowed telepsychiatry through the pandemic, and it's been successful. So ensuring that telepsychiatry is continued to be a reimbursable service and ensuring it's reimbursed at the same rates as in-person visits, and that prescribing can be done versus telehealth can really increase the ability of psychiatrists to meet the need and the willingness of psychiatrists to meet the need, because they will no longer have to worry so much about whether the person can make it to their office on public transportation to make their appointment. It will also allow psychiatrists to meet people where they are. You can't expect a person in crisis on the street to wait 30 days for an appointment in the physical office. We recommend more scattered site permanent supportive housing. The estimated need for permanent supportive housing is approximately 50 to 100 units, and we recommend that those be scattered site for a number of reasons. Best practice in permanent supportive housing right now is for it to be scattered site, not all in one building, for a number of reasons. That helps to integrate people into the community that they'll be living in, because they'll have real neighbors, not just neighbors who've had the same experiences that they've had. It also reduces NIMBYism, because you won't be overwhelming a neighborhood with a group of people that they're afraid of. We recommend greater emphasis on supported employment. We do have supported employment providers in Monroe County, but the biggest obstacle to supported employment of individuals with mental illness and substance use disorders is employer reluctance in hiring. And implementing county and county vendor hiring preferences for people participating in supported employment services, particularly those with mental illness and substance use disorders or former incarcerations related to those disorders, would be a big step in the right direction there. Bloomington has already made some steps in those directions, and so that is a model available. We also recommend ways of exploring ways of making the practice of psychiatry for the most at-risk members of the community more attractive. Some of this has to do with support for people to become psychiatrists who serve these communities in Monroe County, either through grants, requirements on their degrees, or ways of subsidizing their practice or making their practices easier, such as through telepsychiatry. We recommend subsidizing non-emergency medical transportation for target populations. Because of the limits on public transportation, many people can't get to what are their general appointments for mental health and substance use disorders. They're not considered their emergency appointments, and so forth. They can't get Medicaid reimbursement for those. It would be a big savings to the county to be able to do small subsidies for that non-emergency transportation, and there are creative ways to do this that would save money in the long run by reducing incarceration, reducing the crises on the street, and reducing the community injuries by lack of treatment. And then increasing Medicaid enrollment and insurance coverage by helping to fill the Medicaid gaps created by lockout periods, monthly contribution requirements, and the difficulties in enrollment. Some counties have navigator programs that specifically help people enroll and help them gather the documents that are needed for enrollment. And that increases the speed of enrollment. Other options include paying the monthly premiums for people in your FUSE population, in your frequent users population, so they'll never be without insurance, or subsidizing, this is the more expensive period, but when people do get into lockout periods, subsidizing their health insurance costs during those periods so that you don't end up with people in jail, which costs a great deal more than that. It's important to note that these recommendations will be necessary even if Monroe County builds a new jail, as a failure to follow them will lead to the same conditions of overcrowding in the future years, even with a larger jail. If we keep going the way we are, we will fill any size jail eventually. In addition, shifting resources priorities from criminal justice-based interventions to community-based interventions reduces costs, gets a lot more bang for every single dollar, and reduces the pressure on criminal justice staff and resources. Not to mention that failure to take action on some of these issues may well lead to litigation, either by the federal government or by private parties, that will take away the opportunity for Monroe County to design its own system and create this criminal justice system and the jail that it wants. And that's all I have. I'm happy to take questions.
Great, thank you so much. We'll do questions at the end, and we'll turn now to Dr. Ray.
You're muted.
Can I remember what I said? I want to thank everybody for participating tonight, the panelists, council, commission, staff, as well as the community participants. I see a few attendees. I assume some of those are community participants. So when we started this project, the issue on the table was an existing settlement agreement with the ACLU over conditions of confinement. And the settlement agreement is litigation related to the conditions of confinement at the jail under civil rights, federal civil rights laws. So that was one of the first things we began to talk about it to understand the scope of this project. And as we looked at the project, we realized that we were going to need an enormous amount of data to understand the jail's history of incarceration, as well as some of the practices of the courts, prosecution, and defense, to get more clarity on why the conditions that triggered that lawsuit and what would need to be done to ultimately resolve the agreement. So we looked at over 100,000 records, and I want to thank the sheriff and his team for helping us with that. Sam Crow and George, who probably spent more hours than they were interested in the kind of data we were requesting, because it gets pretty tedious. And in fact, if folks have the time to read the entire full report, it's almost 300 pages. I understand it's good for insomnia, so there's one value for it. George and Sam did a great job, as well as County IT, in helping us merge two divergent data sets in order to get the information that we needed to understand what's going on in the jail. What I want to do is just walk through the high points, because there is so much data, and there were so many findings that helped us understand where the jail came from, where it is, and where it's headed, in part if the issues addressed by Eve are not adequately resolved. Because the community issues that Eve discussed are directly linked to conditions of confinement, to the swelling of the jail population, and some of the other things we found. So it's interesting that our paths sort of crossed with our findings with a bit separate context. So what I'd like to do is just briefly go through this quickly, because it is a lot of information, and you all can, the attendees and the participant panelists can review this in detail later. So what we found that was really interesting, looking at jail data back to 2003, and we brought it up to 2019, but we used the 18 data because it was complete, is that there's been a reduction in the bookings. It's not a huge reduction, but there has been a reduction. So with that, you would assume, oh, the bookings are going down, things are doing well. No, that's not true, because there's two other factors you want to look at to understand why the jail population is swelling. The first one is the length of stay. And the length of stay has skyrocketed. And what I mean by length of stay is how long a person stays incarcerated is more important than the number of bookings, because it ultimately determines how many prisoners are going to be there. So what we found is, although there are fewer bookings, the length of stay per booking increased considerably. So if you have a fewer number of people being booked, but their length of stay is greater than the fewer number being booked, you're going to have overcrowding. And that's what we see and have seen since 2003 through 2018, and it also continued into 19. The other interesting thing we found, and I'll put that all in some context here shortly. We also found something very interesting is that the number of unique bookings, and what I mean by that is the same person. So a unique booking is a single person, the same person. The number of unique bookings went down. And what that means is you're having fewer new people being booked in the jail, but you're having a considerable increase in recidivism. And what I mean by that is persons with the same name, the same person, are increasingly being booked since 2003. So one, you've got an increase in the length of stay. Two, you have an increase in recidivism, the number of people being booked more than once. In fact, there was one person that was booked 130 times. And when you look at the report, you'll see that there's actually a large number of people that have been booked more than 20 times and 30 times and 40 times. But the number of people booked only one time has gone down considerably. And that's important to think about, because a lot of what Eve talked about are those interventions, what we would call pre-arrest interventions, that if in place and coordinated well with focused and sort of targeted purpose, can put a huge dent in, one, the number of new people or unique people coming to jail, as well as recidivism. It can impact both of those, which ultimately would drop the jail population. The other thing we noticed, and this is something we're seeing nationwide, is that the profile, so to speak, of the jail population has changed considerably. Bookings for males has dropped. Bookings for females has increased. But that's also a national trend, and it's been going on now for a good decade. And there's a variety of reasons for that, generic reasons. And then there are specific reasons related to Monroe County, but those aren't too far from the generic causes for that. The other thing we noticed was the length of stay for women increased considerably more than the length of stay for men. So I want to stop right there with that little bit of information and add some context to it. What we saw when we looked at criminal charges is that the severity of the charge has increased. And what I mean by that is folks are being booked into jail with the more serious charges more often than they did before. So that's an issue. The other thing we noticed when we looked at some court data, we found that the case processing times, how long it takes from a charge to be filed for the disposition to be completed, is considerably longer than the national standard. And there's a variety of reasons for that. It could be resources. It could be how defense manages their case, how prosecution charges their case. There's a variety of things that you'll see in the report to take a look at. The other thing we noticed that is contributing to the length of stay is there is an unusually high number of continuances on cases. So a continuance is where counsel would file a motion to continue the case for some reason. It could be there's an evidentiary issue. It could be, access to defendant. There's a variety of legal reasons that you would file a continuance. So those three things specifically, increased bookings on serious crimes, continuances, and then long case processing are probably the primary drivers for why the jail population has increased. And there may be other issues related to those. For example, it may take longer for the state to move prisoners to prison. Another issue is it's very difficult and unnerving to know that the Indiana state mental health system can be really challenged and make it extremely difficult to get a forensic assessment out of the jail at the state hospital. Because then what that does is it exposes the county to increased liability because there are seriously mentally ill people in the jail that the jail is, one, not designed for, it's not funded to care for, and as Eve said, doesn't have adequate clinical staff to manage. And that's a serious issue. So that's an overview on the population. Now, one of the things about the jail population we found was jails have two capacities. One is what's called a functional operating capacity, which means the number of inmates it should not go over because it's funded for, designed for, and has to maintain a certain number of empty beds in order to deal with changes in the inmate population. And then there's what's called the total capacity. As a standard, an industry standard, and a safety standard, and a liability risk management standard, you really don't want to go over your functional capacity for very long. You want to keep it down to that or right below it. Unfortunately, the jail has exceeded its functional capacity since 2004 and has exceeded its total capacity for about the past 5 years. And that's a serious issue because it creates untenable safety and security risks. It puts excessive wear and tear on a 36-year-old facility that really can't function effectively at its functional operation capacity. So that's an important thing to realize about the jail is not only has the population increased and is staying high, but it's worn out. So when we realize there's some worn out stuff going on, we brought in an engineer architect who specializes in jails to help us understand what are the problems. We want to be very clear, give the council and the commissioners a factual assessment of the conditions of the jail. And what we found was scary. We found structural problems. We found systems problems. We found ADA problems. We found design issues that are very high risk, lack of adequate space in the booking area to manage the increase in the population, lack of adequate space for particularly the separation of inmates for their own safety and welfare, specifically because the jail populations all over the nation, to include Monroe County, has seen a startling increase in folks with serious mental illness, substance abuse, as well as getting older and who have an increased prevalence of chronic medical illness there. We saw that as well. So when we reviewed all of that, and you'll see in the report, we placed the issues we found in high risk to lower risk categories and estimated what it would cost to renovate the jail to, one, fix those systems and structural problems at about $51 million-ish. But that didn't include what it would cost to renovate the jail to provide the necessary capacity to hold the population it has, or to redesign it to ensure that the prisoners, that it can accommodate the constitutional rights for prisoners. And that was a big issue as well, because unfortunately, it was difficult to find, and despite, as professional, and we were very impressed with the professionalism of the sheriff's staff, the correctional staff, they maintained a unique, unless it was just for our presence, which I don't think it was, a unique positive relationship with the inmates. I was really impressed in how they communicated with the inmates. It was a friendly yet professional tone. Even when one officer was dealing with it, I could see a very troublesome and troubled young man with a developmental disability who also had mental illness. I could see that when I was talking to him. They did such a good job communicating. I think that, combined with keeping it as clean and painted and as maintained as they possibly can, is what I think has kept it from exploding, so to speak. I don't mean the building, but keeping the conditions of confinement as best as they possibly can, as well as treating the inmates with the respect I saw, is in large part likely why you don't have more litigation. And that's an important thing to think about, and to remember that, you know, some folks can live in a cardboard box, but if they're treated with respect, you know, it's not as bad. And that's an important factor in jail management. So the bottom line is that you've got a population that appears to be growing, has grown out of your control, a length of stay that has grown beyond the jail's capacity to handle. You have a population that requires services and specific kinds of jail space that it wasn't designed to provide. And that, I don't think, it's anybody's fault, because when the jail was built, those issues and the inmate profile didn't exist like it does today. But we've seen probably a durable change in the inmate profile, which has made it much more difficult for counties and sheriffs and jail administrators to manage, and has made, unfortunately, litigation more likely. And in part, you see that with the litigation you've got with the ACLU. So with that, I guess I'm done with a 245-page report based on over 100,000 records, interviews with staff, and a tour of the facility.
Great, thank you so much, both of you, for your great presentations and all of your hard work. The next item on our agenda is about next steps, and I wanted to see if anyone from the Board of Commissioners or the Council have some ideas. Ms. Hawk?
Is this time for us to make a comment to Dr. Ray?
Well, we do have, We do have a comment period next, and we could do that and then come back and talk about next steps at the end. So I'm just as happy to do that if everyone's okay with that. Yeah, okay. So we'll go ahead.
I just wanted to mention that this sounds a lot like what we heard several years ago when the court said we need 2 new courts so that we can get them moving and not, the stay wouldn't be as long. They got the 2 new courts, and I'm not sure we saw the kind of improvement we would have liked to have seen. And I just want to say that because none of you were here at the time.
Thank you.
Okay. Do any other stakeholders, which could be anybody from any of the groups from Monroe County that were engaged in this process, anyone else have any other comments or questions that they would like to share with the consultants? Go on. Let me see. Commissioner Jones.
Yes, obviously there are a lot of things that we can do to address this problem. One of the things that's really concerned me is that so much of what would be very effective are things that would take place in the jail, and yet we pretty much cannot have them take place, at least in our current jail, because there's no space for it. These are things that would help us out incredibly, but we obviously are not going to have a new jail just at the blink of an eye. It's going to be, if that is our direction, it'll be a very long process, I'm sure. So in the meantime, it seems to me that the best thing for us to do is really pursue the recommendations that are pre-jail and post-jail, since we can't really get a lot done in the jail. Is that an assessment you would agree with? And do you think that could help us reach our goal? Either of you.
Well, I think it helps you towards your goal, but it's not going to help you reach your goal, because your goal is multifaceted. It has multiple outcomes. But I believe that the low-hanging fruit, so to speak, that you can begin to address, you should address it for the reasons you just said. I mean, even if you got the population of the jail down to within its functional capacity, you're still facing serious liability issues because the facility itself has so many problems that it keeps you exposed to these issues. So there's either got to be a renovation or new construction. I mean, that's something that's the difficult choice that ultimately has to be made, and how you can implement the programs you just talked about, you're thinking about, that's being recommended. A facility can accommodate those programs?
And I would agree that a lot of the most urgent things you're going to need to do, even if you're considering a new jail, is to deal with what keeps people from going in and what keeps people from returning to the jail. So the pre and post is important, but you cannot overlook the things that the jail itself can do. And even without a new jail, even without a renovation, there are things currently that the jail can do to support both those, and that the sheriff's office and BPD and IUPD, for example, can do, and that you can pressure them to do, to assist in the pre-jail interventions and the post-jail interventions.
Right. Great question, great answers. Thank you so much. Next up, Council Member Deckard.
Thank you very much for not only the report, but coming in and talking us through this for the members of the public and the various stakeholders. And of note, as I move towards my question here, as of note, there's a lot of stakeholders to this, and your report has certainly identified many within the county government structure and beyond. And as you have noted well, we have a diffuse system with lots of moving actors, not one single entity fully responsible for every aspect of that. And I guess my question is, you talked about a coordinator within the justice system, but I'm curious if either consultant in working with communities in implementation, has there been a process that's been used that got this much done? Should all stakeholders, pick what they want to from these options that gets those things done? Is there any process that you would recommend for implementation that would make sure things get done and don't get lost in that diffused responsibility and many different actors shuffle that we have here?
Yeah, for me, it seems like a sort of pyramid of groups, a small group at the top that is responsible for making sure that things get done and things get reported, that has the right connections and the right authority to push things forward. From there, subgroups or subcommittees who focus on particular issues. Part of the thing is that the groups have to have the shared goal, the shared point of reducing incarceration, avoiding and preventing further reincarceration. And so many groups exist already, but they don't use that goal. The small group needs to involve not just the criminal justice system, in my opinion. The public health system is also a very important player in this because they're the liaison to the community services providers. So it's not just saying the criminal justice players should be part of that small group, but also saying that the public health system should be a part of that small group, and that the rest of the community stakeholders play in the committees on figuring out how their piece of it works. What I would say has happened in Monroe County, as it's happened in many counties, is things have gotten siloed, and they're siloed based primarily on funding sources. So mental health has traditionally been siloed by its funding sources. Homelessness has traditionally been siloed by its funding sources. Criminal justice has similarly been siloed by its funding sources and by the government responsibility for it as opposed to the external responsibilities for it. Substance use has been siloed by its funding sources, and employment is seen as a massive problem that nobody can manage to take on. That's why I talk about focusing on the fused population, the frequent users. To the extent you can identify your frequent users and target the pieces of all those systems together towards those frequent users in an enmeshed way, as opposed to I'll do this person for this particular service and you'll do this person for this particular service when they can get an appointment with you, and this other group will do this person for this particular service, and meshing them more together is the way to go. So getting the groups together in committee work that has responsibility to report back on what it's done and what it's come up with is really the way to organize it.
And I would agree with that. The first question you asked, if we had any experience with that. And I have a lot of experience with that, particularly with systems that have been very successful, but I've also seen them, drop from the sky on fire, so to speak. To give you an example, back in the late 90s in a state where I was a corrections director, legislators passed a law that said all counties must have a criminal justice plan in order to get something. I'm not sure what they would get. So they had to do it. And the counties therefore had to engage this process, in large part because of the jail overcrowding problem and the incarceration rates had skyrocketed there. So when the state passed that law, the counties got to work with their studies. And then from the study, they had to submit to the state their comprehensive criminal justice plan to make the necessary reforms according to the studies that would get them to the place that they wanted to be in terms of incarceration and justice. One county I'm very familiar with, their plan resulted in a 40% reduction in their population within 4 years. Because jail population, not the community population. They all left. Because the system came together with the community and with the other community entities that Eve just talked about came together harmonically, I would say, but certainly, there was some gnashing of some teeth and some hair pulling to get things moving. But how they did that and how others more recently I've seen be so successful in what it is you want to achieve was they approached it with a structured and systematic method. So the first thing they did was determine they've got their information, their study, they need to develop a comprehensive reform plan from which the group or groups who would be involved can operate from. So they know what they have to do, they know generally how they're going to do it, and they know where they're going with it. A basic plan, right? You really have three basic tracks to your plan. If you choose to develop one. The first is the jail. Okay, so you have the jail as a facility, the structural, issues. You have the jail population issues we discussed, which overlap to another track, which is courts, prosecution, defense, that piece of work that needs to be done. And then the third track, and these would all be running concurrently in terms of working the plan, is the community. A lot of what Eve just talked about, virtually everything she just talked about, that's that track of the plan, right? So with those three tracks working from a coordinated plan that has continuity between the tracks, because if you hit a domino, where's it going to go? Sometimes you don't know. And it stays coordinated. That's the real trick. You got to have somebody with the energy, the tenacity, and the will to keep the plan moving and to work well with the stakeholders involved and responsible for moving their part of the plan down the road. But they also have to work together to be sure that what I'm going to be doing over here in courts, prosecution, defense, is it likely to have the impact, or the question would be, what effect is it going to have on jail? What effect would it have on community? And you have that same sort of symbiotic questioning going on. If I do this to jail, what's it going to do to courts, prosecution, defense? What's it going to do to my community? Give an example of what I mean there. Most of my work is for the federal courts. I monitor settlement agreements, or I monitor jails for counties as a risk management role. And a lot of my work is in medical and psychiatric care of inmates, looking at how that's going on. One of the important things that an inmate needs to have when they get to jail is a history, and they need to have an assessment and adequate medical care provided for constitutional reasons. But if they're released from the jail and they haven't had that done, it puts a burden on your public health system if they choose to, engage the public health system. And the research is very clear on that it does put a huge burden on the system. So it's important that the coordinator be able to help keep the three tracks, the folks in the three tracks, tied together enough where they're monitoring where they're aware of what each other is working on, and being mindful and aware of how that's going to affect other parts of each track, if that makes any sense. But the starter is you got to have a coordinator to do this. Second, there has to be consensus that you are going to develop a comprehensive plan. Unfortunately or fortunately, you don't have state legislation, state law that says you have to. That sometimes helps, right? Because you just got to do it. But you have to, have you have to develop that plan. And the important thing about a plan, not only is it clear, it's developed in a structured, systematic way, but what you're going to do, what the plan says you're going to do, you can measure, right?
Right.
You can evaluate to determine, one, is it being done efficiently, or is it being done? And second, is it likely to, or is it having the outcome that you intend it to, right? That's really back to the question about the goal. The goal is to be able to measure you are in fact enjoying the outcomes that you want for your community with regard to justice and incarceration. So a coordinator, a good plan, and then everybody hold on the saddle horn, right?
And a lot of this, often in many jurisdictions I've worked with, it starts with doing the sequential intercept mapping as a group. Now, I don't recommend that you do that again, because I've already done it, for you. But sequential intercept mapping, too often in those where they go wrong at times is they come up with something very superficial, and that isn't the plan that Ray is talking about. And that becomes something that just sits on the shelf for the rest of its life and never gets used again. It's having the groups in place, authorized and responsible for carrying out the more in-depth plan.
Excellent, thank you. Councilor Iverson?
Thank you. My question is for Dr. Ray. I really appreciate the depth of your report, and I have to confess, I have not fallen asleep reading it. So we're doing well there.
You're a data guy.
Chapter 2 goes through a lot of the detention center bookings data that you correlated. And I was hoping that you could talk a little bit about why you focus on gender and age and not on other demographic factors such as race or ethnicity.
Well, the reason I don't focus on race and ethnicity is because it's a whole different issue, right? Certainly, there are issues related to disparate incarceration because of race and ethnicity, but that's not what this study was about. This study was simply to understand the major changes in the population profile that has occurred, over since 2003, 2004, to focus more on detention. Gender is separated in jails, right? So if you have an increase in the female population, you have to have more space for females, right? The other thing is you don't have space for the increase in the mentally ill. So I focus on those areas that affect the unique needs of jail design, okay? To go into ethnicity and race incarceration rates, that becomes a very complicated analysis. It can also be a difficult one for the community to wrap their complete head around, because in order to understand whether or not disparate incarceration exists, you can't just look at the numbers of folks incarcerated having different race or ethnicity. You have to look deeply at the individual criminal charges and the justice processes that they were involved. So to say, well, it looks like the percentage of Asian Americans has increased over time, let's say it's increased 40%. Well, the first thing you would want to look at is how has the community demographic changed to begin with, right? It's just a different, that element of a study has a different purpose, and it's not for the purposes of determining jail conditions, how to reduce the population, whether length of stay is impacting the number of inmates you have and such. Now,
well, I think as we have people from, the public watching, and I know people will be reading this report, I think it's helpful to have that explanation just beyond the scope of what the report was asked to do. So I appreciate your answer. Thank you.
Well, but that said, I'll just quickly say, it can be a good thing to look at down the road, because, different community groups have different life experiences and access to the community that can lead to incarceration. And so you can go deeper into some of that and determine, are there certain changes that can be made to the fabric of your community that could help to reduce the risk of incarceration for different elements of your community, if that makes sense.
Sure. It does. Thank you.
Okay, looks like Councillor McKim is next.
Thank you very much. So I want to go back to the previous topic, which is really next steps and how we move this forward. I am and I think my colleagues are also very committed to implementing the recommendations of these studies, and in particular, doing what we can to drive the population of the jail down. And so, to go back to the question of kind of governance, of how in a county government structure where, as I don't think it was said exactly this way, but I'll say it, basically none of us are the boss of any of the rest of us. How we really move this forward and make sure that we don't lose progress. You often hear that if it's not somebody's job to do something, then it's no one's job. And so I'm really just trying to struggle with the actual mechanics of how we start to move this forward from a governance perspective. I mean, having a coordinator is a great idea, but that coordinator is not going to be a county council member. It's not going to be a commissioner. It's not going to be a judge. It has to be somebody, who's kind of not one of the various peers that make up the elected officials in Monroe County. Is it best practice? Do you recommend that we hire somebody to do the administration of these three, of developing an implementation plan? You mentioned the 3 tracks to the plan. Should it be a kind of an independent contracted staff person that does that? I just want to delve deeper a little bit in how we actually take the next steps to make sure that none of these recommendations get lost. This doesn't become one of those many reports that we're good at generating and putting on a shelf and not implementing.
Who it is really depends on who you have. There may be the right person already in a cross-cutting, not affiliated with one of the groups specifically, who has the right connections and the right level of respect from the players. If you do, that person would be it. If you don't, you'll definitely need 2 things. One is a leadership person who has authority from all the players to help lead them, and who has the capacity for leading them and has the connections with the community that you need. But you'll also need, you mentioned administration. I do not see that person as the person who does the doodle polls to set up the meetings. That small group committee and its leader will need administrative assistance, most definitely. And then that could be an outside contractor, but an outside contractor is less likely, like if you were to come to Dr. Ray and say, be our leader, he would say, I don't have enough of the connections in the community to be that person. Then you go to the group model, and having a group that's all committed to the shared goal becomes the leader. Then you have an outside consultant as the leader of the leader group. Does that make sense?
So you think it is possible to have a very small, or a relatively small committee that represents the relative interests that can kind of be the leader along with some administrative support?
Yes.
Yes. Okay. Yeah, I definitely. Yeah, there's just such a, we have to have a group that's large enough to cover the relevant areas, right, but not so large that we can't schedule meetings and get anything done. So, thank you.
Okay, thank you for that. Any other stakeholders? Councilor Spoonmore.
Yeah, I'm just thinking about the small group model, and I would imagine that would be a public body that's appointed. Does that complicate the next steps going forward if those are public meetings, and does that kind of take some of the benefit of the small group out of it?
I would have to defer to your counsel on whether those would be considered open meetings or not. If decisions are not being made, when decisions are being made, my understanding in most places are that it is. When decisions are not being made, then there's more flexibility, but I don't know your open meetings law requirements.
If you want me to answer that question, I'd be happy to answer that. They would be, if it's a specific committee appointed to do a specific task that's delegated, like the council work or commissioners work, and I think this would fit into the definition of a governing body, it would be subject to the open door law in terms of, whether that's, a benefit or not. That's not a legal questions, but I can tell you that Indiana law does anticipate that these kinds of meetings where you're receiving information and making recommendations to decision makers who will ultimately act on your findings are subject to the open door law.
Okay, that's what I was wondering. Thank you, Ms. Rice.
I also want to say, I don't know a way, not that I would be looking for a way around that, but I don't know a way around that. I think given the fact that this topic is so important to the community, I think it's valuable that those meetings would be open door, because this is obviously clearly a very public conversation. Not to say that there can't be conversations that are one-on-one, sort of offline, but the work that this committee would be doing would be subject to the open door law.
Councilmember Hawk.
Yes, part of what I was hearing was that one of the big problems we have that's not going to solve down the road, but now we're seeing that the length of stay is creating a higher population than would be necessary if they had a disposition of the case sooner. But it seems to me that's going to take major buy-in by the courts and public defender. And there's not going to be any committee be able to tell the course of public defender. So I would like to see them start to work together in some fashion to see if there's some way, maybe have night court, do some way that they can move those cases forward quicker. When we see people sitting there for months and months and months because they can't get things scheduled. And that's what I'm hearing. I'm not in the jail. But what can we do other than just community encourage them to do that, but we can't force that. What do we do then? I'm talking to Dr. Ray. That's who I'm looking at.
I'm sorry. Yeah, I've seen it happen. And again, the criminal justice groups that had developed their plans, these were Superior Court judges prosecutor, defense, the whole system, as well as some community, they were forced by state law to have a plan. So they couldn't opt out of participating.
Oh, God.
So the courts and the prosecution and defense, they worked their track according to the study and the plan to develop their plan, as well as the jail worked its piece of the plan, because the sheriff, elected constitutional officer, has total authority over jail operations. But the commissioners, I think it's commissioners in Indiana, you own the building, right? So you have your piece. You know, ultimately, it's not the sheriff, it's probably the commissioners who have to determine, is it more cost effective to fix the jail and renovate and expand or build new? That's a whole different track, right? But you don't have legislation that forces, I'll call it the shotgun, in Kentucky, we call it the shotgun wedding, that has to come together to build a cohesive plan and then to execute that plan with the help of, and I agree with Eve, with a hired coordinator. Now you might want consultant help to develop the plan, because that's a process. It's a systematic process. It has to stay on a track. But once you're done with that, and I think Eve would be great helping you do that, and maybe some help from the university. I'm sure they got planning folks there, but criminal justice planning is a bit of a boutique work. So Eve, someone like Eve, who can help get that plan collated, put together for you. The thing though, and I think what you're speaking to and goes to the heart of your question, is how do you get the buy-in from the courts and the prosecution? Because those are two elected positions, aren't they? Aren't your judges are elected and your chief judge is elected? So that's independence. And you saw in sort of the preamble of my report, I talk about that independence and interdependence. And without a desire to make your independence somewhat interdependent, you're not going to get anywhere. It's going to be, you know, business as usual. But from what we heard is, particularly from the chief judge, Judge Detox, there's a desire to want to contribute, to want to make things better. Certainly heard it from sheriff, and have certainly heard it from the commissioners and the council. So I think maybe the seeds are being planted, and now it's how do we get there from here to begin to develop our plan. And maybe the focus shouldn't be on how do we get people who are independent to do their part. I think it's more about starting from start, which is begin the process of building your plan. Now, that said, I think and this is from experience, I think there's still more learning to do. I think there's more voices in the community that need to be heard relative to what's in the studies to provide you another perception of how it's understood. And I think that's going to take you some time, and that might be part of your planning process, is to gather more understanding from the public about the system. What do they want from a jail? We did this in Vigo County, and it was a 4-question survey. Basically, it was it's centered around what do you want? What outcomes do you want from your jail? And the community dumped, and it was great information. It ranged from everybody should go to jail to nobody should go to jail to lots of reasonable stuff, which is we want people to leave jail less likely to return because of how the jail operates and how the criminal justice system operates, right? Like I said earlier in another meeting, if you really want to punish an offender, help them prepare to go to work when they leave and make them a taxpayer. That's a good punishment right there, right? Make them a taxpayer. But honestly, those folks who have done that actually feel much better about themselves. But I think your starting point is to begin the process of developing your plan, considering those 3 tracks with your studies, and gather and take the time to hear more from your community about how they see justice in incarceration.
Great, thank you so much. And we know that Judge Detox would like to speak, so please do. It looks like you're unmuted.
Thank you, Commissioner Thomas. First of all, on behalf of the Board of Judges, we appreciate the study that was done. We were actively involved in the gathering of the information and providing information. I would like to say that as far as we are concerned, we are as interested and have been interested in the population of the jail and decreasing the population of the jail. So I don't see that as an impediment to gathering people together to talk through how this is going to be done. The statistics that have been gathered through 2018 with some of 2019. I'm here to tell you tonight that the current jail population, total population, is 190. That's way below the cap that Ken Falk has placed in his lawsuit. I would also like to say that for the years that cap has been in place, the Board of Judges has worked diligently to make sure that that cap and what comes with that cap were adhered to. We have 4 problem-solving courts. We are a pretrial release county for the state of Indiana. I want to address the length of stay. The length of stay data is something, well, actually all of the data we gather it routinely, we gather it constantly. And in response to Councilman Deckard's question, we gather data that has to do with gender, has to do with race, has to do with age, has to do with length of stay, has to do with repeat comings, because we're under a mandate to get these cases resolved within a year's time by Criminal Rule 4, unless there are continuances, unless there are reasons. When the sheriff came to us a few years ago about the New Beginnings program, we agreed to participate in the New Beginnings program. But when you look at programming and length of stay, New Beginnings was originally a 90-day program in the jail that a person committed to in the jail, and we, the judges, committed after they completed that phase would be released. Centerstone, because of funding and because of issues, made that 60 days now for that part. We still order people in that. There have been times where people have been waiting to get into treatment. There have been times when people have been waiting to get into homes. We've had people incarcerated for a bit waiting for Kinzer Flats to open. One of the things that has happened, of course, is COVID. I will tell you, the Indiana Supreme Court put a mandate at the end of 2019 into 2020 about jury trials, that they could not happen. There was a brief period of time when they could happen, and we had a jury trial in November for an incarcerated person. And just as an aside, that person, even after having been convicted, he is now in my reentry court due to the cooperation of the prosecutor, the public defender, and the court. But when we could do a jury trial, we did. We're aware that there are people in jail. We are triaging who they are, how long they have been there, how we can get them out of there, how we can do something. There was a jury trial scheduled starting next week, and I was told today that there is going to be a plea. The other thing that happens is quite frequently, resolution of jury trials don't happen until the eve of, for a variety of reasons. I sentenced a young man yesterday for murder. We had the jury trial set. The jury was there. It was one of the first juries we were doing when the Supreme Court opened up jury trials again. He sat and his lawyer and he wanted to converse. They conversed for about 3 hours while the jury was waiting the morning of trial, and he pled guilty to murder, and he was sentenced yesterday. We are committed to looking at programming, to looking at how we get people out of the jail. Pre-trial releases, I would tell you that if we looked at those statistics today about bookings, yes, the bookings should be down due to stride, due to the cooperation we're trying to do to look at who's being arrested. Do they need to be arrested? Should people be summoned? What do we do with those? Which is taking a fair amount of cooperation. I wholeheartedly support the idea of everybody talking about this and everybody working through this. We see the same problems that Ms. Hill, Dr. Hill has talked about. Homelessness, treatment. Where do we put people? How do we keep those people safe? How do we keep the community safe? All of the issues that we're all concerned about. We are dedicated to doing that. We are looking now, we are working with researchers and what we do about people on probation that are facing revocation. We're looking at how to lessen that, how to lessen their jail time for that. How do we look at what kind of programming we can do? But our problem is the same that has been discussed here. It has to do with programming, the cost of it, the fact that it's inadequate. Mental health is an issue that we struggle with constantly. We work with the jail because we know that that's an issue. We get people who are committed to the Department of Mental Health. We cannot get them in the Department of Mental Health because there's only 2 hospitals. The average length of stay waiting after they have been found to be incompetent is 4 to 6 months. For the safety of themselves and the community, there is no place else to put them. They are in the jail. Is that adequate? Certainly not. We call constantly the Department of Mental Health and say, where are they on the list? Are we getting any closer? And to answer Councilwoman Hawk's statement, yes, I think it was like, I don't even know. I think it was maybe just about the time that I was becoming a judge. Was there a new court created? Yes. We have 4 civil courts, 4 criminal courts, and a juvenile court. And the purpose of that was to look at how to divide what is on the cases so that we can work through them. But I would say to continuances, it is something that we look at. It is something that we evaluate case by case, but there are a variety of reasons as to why cases are continued. A variety. It is not a simple fix. It is not a simple answer. I would venture to say that most continuances are requested and done out of necessity for one reason or another. One of the other issues that we have in the state of Indiana is the state police lab. That's where evidence has to go to be analyzed forensically. The state police lab is backed up. It is the state police lab. I mean, and that's out of our control. That's out of the county's control. That's under the state control. But we do the best we can, but we watch the time limits. We watch who's there. Are we frustrated? Yes. Can we do better? Yes. Are we striving to do better? Yes. And do we believe that conversations about the issues that affect everybody in the community that causes people to get into the criminal justice are vital to be discussed? Yes. I think, but I'm going to go on record as saying that the relationship that the judiciary has with the other 2 branches in county government has always been, in my opinion, open. It's been productive. It's been positive. It's been supportive. And I see us going forward with the goal of having this common goal and continuing to work together. But we are committed to do that as well. And yes, we are an independent branch. Yes, nobody can force us to do anything, okay, with the exception of the Supreme Court. But we are serious about looking at who we are serving. Monroe County traditionally has been a county about serving people and trying to get them what they need. I mean, we have 4 problem-solving courts because of that, to try to deal with people's issues, to get them out of this system. Certainly we can do better, and certainly we're committed to doing better, and we're open to the dialogue and the discussion. And again, I appreciate being invited to these meetings. I appreciated us being involved in that study. And I appreciate the continued willingness to be able to work together so that we can solve these problems together, because it's so true. By the time you end up in the criminal justice system, and I think Dr. Ray would support me on this, we're the end of the line. There's been a lot of other things that have happened before you've gotten to us.
Right.
We're the end of the line. And we know that. And we know that there are things that we can do. But even in my problem-solving courts, if I've got somebody who's trying to get sober, trying to do the right thing, but they're living in the same environment they lived in, and they're facing the same issues and dealing with the same people they did before, it's very, very difficult for them. But because of the lack of resources, we only have so many. We try to take the most vulnerable, let's say, and put them in supervised places as we have them, at least to begin our program, so that we can help them start that way. But thank you for your time. I don't want to take up any more time because it's not my meeting, it's yours. But I did want to say that our branch of government is committed to, with the other two branches of government, to moving forward.
Yeah, that is fabulous to hear. Thank you so much. And this is really all of our meeting because we have so many stakeholders who are here, and it's really heartening to hear your interest and willingness and commitment to this. It looks like we have some folks who wish to offer comment from the public or for questions for our consultants, which should be our focus today. Does anybody else from the stakeholders group have anything they want to add at this juncture? We'll come back for some conclusionary comments. Anyone else? I don't see any hands. I don't see any movement on the screen. Okay. So with that, let's go ahead and open this up for public questions for our consultants and public comment. Just for the sake of, we have almost 40 participants. So for the sake of everyone, if we could keep comments to 3 minutes per person, that would be great. Let's try to do one round, and if we have time, we can look at doing another round. Just kind of improvising here as we go. So it looks like we have one person so far who wishes to speak. There's a timer on the screen at 2 minutes and 30 seconds. You're going to hear a tone, and you'll know that you have 30 seconds left to speak. Vox Booker. Good evening.
1 second.
Okay.
Fox Booker needs to be promoted because of an older version of Zoom.
Got it. We'll move a little more slowly. Thank you. Good afternoon. Good evening. Sorry.
First of all, thank you to the commissioners, counselors, and the consultants for all being here and taking on this task. It was good to hear Judge Detox as well voice her willingness to be part of the solution. First, I want to say we must always consider the aspect of race in everything we do. I can understand why consultants might not want to take on that aspect, but it permeates every element of American society, and we should always keep a watchful eye, especially since we've seen in our local court system, things like ending cash bail drastically reduced the amount of stay for folks who were in jail that were Black and other minorities. 2 years ago, before we began this, I came to the commissioners and some of the county staff and asked to lead or be involved in a citizen-led commission that would take on these problems from a holistic point of view. I'm happy to hear that the consultants have also recommended that we create some type of local commission that would take on these tasks. I think Monroe County and Bloomington are communities that are uniquely suited for this task. We have a great deal of expertise and willingness in our community. And I think the best path forward is to go to the community, and the same way that we create any commission and create this really public-led, transparent commission that is empowered to create recommendations and changes that just won't sit on a shelf. It's imperative that whatever we do be led from folks that have lived experience. And With that, I cede the rest of my time, and I thank you all.
Thank you, Mr. Booker. We appreciate you as always. Let's see if there's anyone else. Ooh, former Commissioner Charlotte Zitlow. She's worked on this for many, many years. Ms. Zitlow, whenever we're going to get you on screen here and get you unmuted. Maybe. There we go.
Okay. Thank you very much for letting me speak. You know, I've been involved in this since the 1960s. And I think that we've made tremendous progress over the years, but we still have more to do. There's no what the consultant, I came in late, but the consultant was suggesting that everybody might be able to work together. And I'm absolutely confident that that's true and that you can all come to some resolution of this as to how to go forward, because this county does really believe in community corrections and in minimal in recidivism and in reducing recidivism, and that helping people re-enter the community with prospects for the future that we all need to support. So I just want to say that I want to encourage you. We had a community corrections collaborative, I can't remember, it was a lot of words, task force for years. Joe O'Connor's chaired it, and I was a secretary, and I took many, many notes, which brought all the county, all the elected officials to do with criminal justice, plus the hospital, plus the Centerstone and so forth together. So that is still on the books, but it was never repopulated after about 10, 12 years ago. So you have a structure if you want to go back and use it. But your structure, the structure I see on the screen, I have full confidence in. And I think that as the consultant was right, I think you can all work together, that there's willingness on everybody's part to do something. You should just do it. Congratulations. Thank you. I did it in less than the time that you gave me.
You did. You got 1:15 left. Great. Thank you, Ms. Charlotte Zitlow. We appreciate you so much. And your expertise and experience are always great for us. So let's give, go ahead.
I'll give you, can have my time anytime you want it, okay?
Okay. Thank you so much. Let's see if there's anyone else from the public who wishes to speak. You just have to click on the raise hand icon on your screen, and we will get you over to our panel so that you can speak. While I'm waiting, I just want to note that I see a number of members in attendance from the Human Rights Commission, and I do want to thank them for all the work they did on the community conversations that we had, but also the work they continue to do on human rights in Monroe County. So a little plug for them as I'm waiting. Okay, I do not see any more, but let's come back to our stakeholders. It looks like Councilor Wills has a question or comment.
I have a question. Thank you. Just to follow up on Mr. Booker's statement, I'm wondering, Dr. Ray, if we have the racial and ethnicity data as part of the data set that you were given access to, and I know it was a lot of work to coordinate and organize. And if not, is that something that you know of that is gettable? I mean, beyond, I know it's outside the scope for you to analyze it and look at that. I heard that from you, but I'm wondering what options we have to look at that kind of thing.
Yeah, no, that's a good question. You're booking, you've got two data sources that you would look at. The 85,000 booking records, I believe, had race, ethnicity, length of stay, charges. So I think you have that, and you certainly could study just that to generate the good questions you need to ask why, right? And then what can we do about it? The other data sets are going to be from the court system, which talks to case processing times. Is there, is there a difference based on ethnicity? I would be shocked if there is, but I have seen a lot of literature that says there is. So you do have the data. I'd be happy to drop box back to you what I had, the raw data, the literal data set that we had to merge, and you certainly could study it.
Okay. I know we've got a couple of other things going on. The prosecutor's office is looking at some of those types of factors. And we've had studies in the past too that have looked at this in our community. So it might be, I might hit you up for some data. We'll see. It's been a while since I've done SPSS or any of those things, but we could try it.
That's what I use.
All right. All right. Thank you.
Great. Does any other stakeholders have, it looks like we might have a member of the public who has a question, but not. Okay. Do any of the other stakeholders have a question or comments or a discussion about next steps? I think the idea had been floated to, let's go to Ms. Hill for hands raised. Thank you. No,
Just
thank you.
On Mr. Booker's comment, I did do some analysis of race, mostly because the mental illness and substance use disorders don't affect people of color more than they affect white people, but they tend to be less likely to be able to get treatment. And part of that is it appears to be in Monroe County because uninsurance is more prevalent among people of color. So for there appeared to be a substantial underinsurance for Black, Asian, and Latino residents.
Yeah, and that is definitely important. That definitely plays a role in everything else that you discussed. All right, anyone else? Councilor Spoonmore.
Yes, thanks. I just want to, before we close here and discuss next steps, I just want to say that I'm really encouraged with the discussion that we've had here this evening, and really appreciate hearing all the willingness to collaborate on this. I think that, I really want to see this move forward, and we can talk about what those next steps are going to be here soon. But, we've got a real opportunity, I think, here to make some transformative change in Monroe County and really impact some change for our future here. And so I know a lot of you get involved in public service for that very reason. It's something that that motivates me very much. And I want to go back to Mr. Booker's remarks earlier. We've got a lot of stakeholders in this meeting. Perhaps the most important stakeholder is the public, and it's going to be very, very important that we continue to engage the public every step of the way in this process and have meaningful opportunities for them to participate in these discussions, and that this is not just happening in a vacuum. So I appreciate those remarks, and also appreciate all the Human Rights Commission members that are here as well too. But that's all I really wanted to say, and look forward to discussing those next steps here.
Yeah, great, thank you. And I would say I agree with everything that you had said. We do need to work together. It looks like everybody's willing, and this is an incredibly capable group, but we also obviously need the community. We need their input, we need their expertise, we need their experience, we need their understanding. We need to bring all of that together. And I think that we are well equipped to do that. And it sounds like our heart is in the right place, and we just have to get the rest of us in the right place. I think one of the ideas that was floated at a meeting yesterday was to meet again, the stakeholder group here in 2 weeks, which is July 7th at 5:30. We can hear from the public again. Hopefully folks will have more of an opportunity to at least hear the presentations, or perhaps read through the report or portions of the report that they're most interested in. and we can hear again from the public about, ideas that they have, but we can also plan our next steps as a group. And we don't want to lose our momentum, and we definitely want to use this great information. And I cannot thank our consultants enough. Dr. Ray, Ms. Hill, thank you so much for all your hard work. You've been amazing, and this has been eye-opening, and it's really helped us get a solid footing for taking our next step, because we need this information, we need this data, and that's what we have. And so appreciate your data, your experience, and the ideas that you've provided us as well, because there's some great ideas, there's some gems in this report. Is everyone okay with meeting in 2 weeks at 5:30 on Zoom, or possibly hybrid, depending on the governor? We good? Okay. Great. And I appreciate everyone who's here on this call, and I appreciate the public for attending today as well. Really do want to thank everyone's attendance and attention, because this matters such a great deal. None of us can do this alone, and we are a strong group. Anything else, Councillor Spoonmore?
No, not here.
Okay.
May I ask, is there anybody still in the public who has a raised hand? I asked TSD just before we close. I want to make sure that if there's anybody who still has a raised hand, that we address that.
I have been watching the attendees list, and I have not seen any.
Yes, there is one.
Oh, there is. So okay. So TSD, tell me. I apologize.
Susan Gray has been given the ability to talk.
Yes. Thank you. I don't know how you see a hand, and I don't, but thank you, Ms. Gray, for your patience.
It's just, can you hear me? Am I unmuted? Okay. It was just a very much of a comment on Ms. Wiltz's talking about the data. I know that 3 or 4 years ago, Guy Loftman did a huge data crunch on racial disparities. And so I assume you know about that one, and if you want to recrunch new data, that would be fine. That was all I wanted to make sure that everybody knew, that there was a huge data crunch back then. Thank you.
Thank you so much. I'm looking for hands, and I still don't see any, but maybe TSD. Do you see any more hands that we're missing here, that I'm missing?
Nope, it was just the one.
Okay. I don't know how I missed that. I apologize. I see it now. Now it's gone. Okay. Anyway, anyone else have anything before we close out? And again, our hearty thanks from all of us to Ms. Hill and Dr. Ray for all your hard work. Anything else from Ms. Rice? Anything else?
Oh, just a great big thanks to everybody for your time.
Yeah, hugely important. Great. All right. So we'll come back to this in 2 weeks, and hopefully anyone in the public who is just watching this replay will join us and share their ideas and as well. So thank you so much, everyone. Appreciate you.